Hey, good afternoon, everybody. Dr. Alex Kallio here. Hope everybody's having a good Wednesday, and we're looking forward to getting to talk about headaches today. So we'll see as we get everybody on today. Hopefully we get a good crowd. I know we had a lot of interest in this topic, mostly because of course, I think we have a lot of people out there that are suffering with headaches. So we're going to talk a lot about headaches and treating headaches without medication today. Big thing we want to go over, and by the end of our few minutes together today, is be able to give you 4 action steps to take with you, be able to really get implemented with some things at home. So for those of you that don't know me, my name is Dr. Alex Kallio. Again, I'm with Comfort Family Chiropractic here in Lincoln. I am the owner clinic director here, and I have been in practice for almost 20 years. So this is something that I have literally seen thousands of patients with tension and migraine type headaches, and glad to say that over those nearly 20 years, we have been able to help a lot of people with this. So one of the things, first off, when those of you that may be jumping on with us here, certainly as you do, make sure we hit the wow button, hit that heart at the bottom, share this talk out there, make sure that other people are seeing this video, make sure they are getting this information too. So certainly as you come on, hit the wow button, hit that heart button, and tag some friends. If you have friends or family members that suffer with headaches that need to get this information, make sure we put their name just right below in the comment section there. Type their name in, that way they'll be able to see this video later on as well. So great to have everybody coming in, and we'll look forward to getting this information out. So the first thing we really need to know when we start talking about headaches is talking a little bit more about the anatomy of where these come from and what happens with this. And so, you know, when we think about a headache, whether it be a tension type headache or a migraine or other type, biggest thing is they are known as what is called cervicogenic in nature. And what that means is those headaches are coming from that upper spine, a lot of that upper neck head area, and not coming from many times, you know, outward sources or even internally, you know, from the brain itself. It is cervicogenic in nature. And so we think about how the body and the spine is aligned. We have our cervical spine, basically, that is curved, that protects the nerve and the spinal cord, the brain and the skull that sits on top of that. And in between each one of those vertebrae, there is a pair of nerves that come out. Now, the most important part when we're talking headaches sits in the very top portion of the neck. It's the first and second vertebra there in the neck, and they're actually so important that they are named, and they are called the atlas and the axis. There won't be a quiz on that here before the end, but those top 2 vertebrae are vitally important when it comes to headaches, in that the nerve tissue from there supplies back to all the muscles of the head and the face, eyes, ears, sinuses, and the brain. So very important things when it comes to dealing with headaches. So especially there, you know, as we look at that nerve distribution, the biggest thing that we look at and starting to see in terms of playing in with headaches is what happens when that normal anatomy, normal alignment changes. And especially we look at several things. In the normal curvature of the neck front to back, is there any lateral deviation in terms of curvature or rotational misalignments? We can get tilt, we can get torque. Any of those things will cause disruption and interference and pressure within the nerve tissue, within the joints, within the disc, and within the muscles, all that can contribute to headaches. And especially when we look at the main 2 types we're talking about today, tension and migraine headaches, that structure and anatomy of that upper part of the spine is crucial and tends to play in, you know, I would probably, you know, wager probably 90-95% of those headaches stem again from that neck in origin. So certainly as we're starting to get some people jumping on, you know, anybody suffering with headaches, make sure, let us know, you know, type yes or no into the comments there. We'd love to start hearing from you, and again, make sure we're hitting that wow button, hitting that heart button, and sharing this out there. So looking at causes of headaches, certainly there are lots of different types of causes, from the environment to food sensitivities to hormonal causes stress and posture, all of those things can play in causing headaches. The two biggest ones we're going to talk about today are stress and posture. Probably the major contributors when we look at tension and migraine type of headaches, both physical stress, mental stress, all of those things play in. And certainly when we look at why that is, especially in my 20 years in practice, it's changed. And especially today, one question we'd ask is, how are we doing this talk? Yeah, through the phones, through computers. We're in a very heavy digital age here that, along with that, while it's made our lives certainly a lot easier over the years, certainly this has started to cause some problems as well. So when we look at our posture, and especially when it relates to being at the computer, being on the phone, being on the laptop, those things have played a crucial part in some of the increases in the amount of headaches that we're seeing. Matter of fact, there's terminology that's used out there right now called text neck. Some of you may have heard that term or used it, but it is a literal coined phrase for describing what's happening because of this head down forward posture. And so when we go back and think of that anatomy again with the curvature and how all of the nerves and joints and muscles and everything kind of sync together, because of a lot of these head down posture positioning, we are really commonly seeing a curve that should come backward in a nice reverse C, starting to come straight, reverse forward, and we're really creating a lot of displacement of normal muscle balance, increasing pressure down into disc and joints, creating nerve pressure, creating headaches. Kind of picture having a bowling ball. If you held it close to your body, you could do that for quite some time, but if you took it out in front of you, you're not going to be able to hold that very long. All those muscles in your shoulders and chest are really going to wear out very quickly. It's the same thing that's happening with our head, is for every inch of forward head translation, we are adding up to 15 to 20 pounds of pressure down into the disc and joints, onto those muscles, and they are having to hold that. It's where we get into causing a lot of those tension headaches that'll sit up at the base of the skull. Those will wrap in a hat band kind of coming around the forehead and temples. And then, of course, if the nerve gets irritated enough, that will kick in more of the migraine. Migraine headaches, kind of kick up a notch from tension, where we get into having more so of the aura, light sensitivity, sound sensitivity, nausea, and many times people missing work, missing kids' activities, really affecting life pretty heavy. So, these things certainly can impact our life day to day, and if we are able to manage and reduce these things, it can be a life changer, certainly a game changer for a lot of people. So, really we look at getting, our first action step. We really have to improve our digital posture. So that first action step is going to be improving our digital posture, our digital ergonomics. So starting from the computer, we're going to kind of run through these a little bit. So looking at computer, and certainly how many of you are at a computer every day is probably just about everybody. Certainly chime in with a comment. Anybody along the way here, you're more than welcome. But when we look at computer posture, it starts with the chair that we're in. So, slumped down over the computer and leaned in and leaned over and these kind of things, we really want to watch. And it starts with a good chair. So ideally, we'd recommend having a high back, solid back chair, something that comes up, at least past your shoulders, with a good ergonomic support in that lumbar spine. And the first thing for a chair to be effective is you have to be able to sit all the way back into it. So we need to get your butt all the way back in the chair, be able to have that supporting that small of the back. And I'm going to turn sideways here a little bit. But when we get in and we see, if we go from this kind of posture positioning to support it in the small of the back, you can see automatically what that does to my shoulders. We get this supported, shoulders drop back, become more relaxed. But the trick is we can't hold ourselves up in that position. Mom yelling at you, sit up straight. Sounds good, and for a short duration we can do that. But if you're trying to do that at your work desk and hold yourself upright, that's not going to last very long. So, muscles are going to get tight, they're going to get fatigued. We need our chair to hold us in that position where we can relax those muscles, be in that nice ergonomic, relaxed position. And then once we have that set, and especially kind of focusing to our female listeners, the getting back into the chair, if the chair is fitting you correctly, you should have about an inch or two from the edge of the chair to your calf muscles. there. If your calves are hitting that or your legs are getting pushed up, you're not going to be able to sit in the chair correctly. So watch your fitting. But then once the chair is set, now we want to look at our keyboard and our mouse, and we should be able to completely relax our arms and shoulders, elbows to 90 degrees, relaxed at your sides. That is where keyboard and mouse should be. If you're reaching forward, if you're reaching up, if we have to do this kind of thing, again, we're drawing forward, we're pulling a lot of tension in those upper traps, what are called the levator scapula muscles here. We're going to get into creating a lot of postural stress and tension, leading into headaches and neck issues there. So we need to, whether adjusting our chair height or getting a drop-down tray, getting those things moved. And once we have that positioned correctly, now we can adjust our monitor height. And we want to get monitor height, about top third of that monitor should be at eye height, where we're looking straight ahead. Again, nice relaxed position, and about 24 inches, about 2 feet from your eyes to the screen would be ideal setup. And of course, I know we're going to get into specifics of some people with 2 monitors or having different setups, and that we got to dial in a little bit more. But there still can be things there that we can dial in too. So biggest thing though is getting back and being able to get that nice ergonomic neutral posture positioning, getting out of this kind of thing on the computer. For a laptop, it goes a little bit different, and of course the problem there is your keyboard and your mouse and your screen are all connected. And so if we leave those together and we get the keyboard and mouse in the right position, heads down at the screen, we go the other way, we're up. So we really recommend having either a wireless or a plug-in keyboard and mouse for a laptop, where you can set the laptop up, the monitor screen up high, get your chair set properly, and then be able to have your keyboard and mouse down appropriate too, especially for home use. If you're working from home or working in a car, that kind of thing, you can really get that stuff separated out and get yourself in a much better posture position with that. And then lastly, with the phones. This, if we're even just doing a quick text, it's that looking down. We want to get those up, be able to, rest your elbows into your torso if need be, or if you're at home, there are specific lap desks that you can get to hold those things upright a little more. You can certainly get into even just laying a pillow or something across your lap to rest your elbows on. Get that upright, and where we're not keeping that head down. That's going to be a huge thing for headache sufferers. So that first action step, we've got to improve that digital posture, really work on getting more upright, but allowing those muscles to relax. So the second thing we need to look at then is looking at our sleep posture and support. When we start talking, 6 to 8 hours, a night, when we look at our posture positioning, this can have a huge impact on headaches, and especially those of you that might be a stomach sleeper. Anybody that is listening here, certainly you can reply yes or no, but are we a stomach sleeper? And then second part of that is, if so, how many pillows have we gone through? Some of you, especially headache sufferers, not uncommon that I'll talk to patients that have gone through 5, 6, 7 different types of pillows over, even the course of a year, trying to find something that works. And it's typically a combination of their posture, their positioning, the support that they're on that's causing some of that issue, and why they're waking up with headaches or developing those through the day. So, really the best way, stomach sleeping, we've got to get away from. Problem there, if we picture that positioning, head is turned, arms usually are up overhead, we're twisted, we've got, leg drawn up, we're creating all this torque and twist within the spine. That can be a big reason why we're developing neck, headache, shoulder type issues. So within that, we need to go to either side or back sleeping. Both are acceptable. The one caveat we get into that is trying that to be off of the shoulder, not rolled up into it, pinning that arm underneath you, and trying to stay more neutral. And so typically, one of the biggest ways to keep that head and neck more neutral is with an actual orthopedic cervical pillow, an actual pillow that's designed to do that. The biggest difference between an orthopedic pillow and a regular pillow is where that primary support sits. Primary support with a standard regular pillow is at the head. That's why when you lay on your back, your head typically gets pushed up, or you're trying to bunch that pillow up underneath the neck. You're artificially kind of knowing what to do. You're trying to get that support in there. Problem is, it doesn't stay. So, there we have to get with an orthopedic pillow that actually is designed to give primary support at the neck, secondary support at the head. The biggest mistake we see people make, though, with getting pillows, even if it's a good pillow, a good orthopedic pillow even, is that it's the wrong size. And so, we have to get those fitted the right size for the individual, but also for their condition. As people with big curvature changes or arthritis or disc issues, those kind of things are not going to be able to tolerate probably a really contoured type of orthopedic pillow. They're going to have to get into another type, and that's really where we come in of not only diagnosing what's going on with the spine and condition, but then matching that to posture, positioning, proper support, getting that all dialed in. And it's the same with our side lying. We need to have that pillow to support from the shoulder into the neck to keep the head level and not creating that lateral tilt either way if the pillow is too big or too little. So a lot goes into that, but we've got to get more neutral in our sleep posture positioning. We've got to get better support to our head and neck through an orthopedic pillow and really get off of that stomach sleeping when we look at that. So first two action steps, again, we're kind of getting into improving our digital postures, and second step, really working at improving our sleep posture positioning within that. Third step, then, we've got to start looking at reducing stress. Stress, we did stress and posture, kind of the two big things that play in here with these type of headaches. Reducing stress is absolutely vital. And there, again, this could be a whole day topic on stress reduction, but one of kind of the top ways that certainly we recommend is through exercise, stretching, and massage. Regular exercise is absolutely vital to improve all kinds of things as it relates to headaches. One of the big things when we have a lot of stress is it increases a hormone that's called cortisol. Cortisol basically breaks down muscle tissue. It increases tension. It's a big player when it comes to tension type stress related headaches. And everybody says, it's just stress. I'm stressed. I got, well, yeah, but it's creating a reaction in your body, and it's leading to a physical reaction, not just a mental one. And so we get changes in muscle tension. We can get pull and imbalance within alignment. All of these things kind of play off of each other, and a reason why we keep getting some of these chronic headaches. So we need to look at reducing stress, and certainly one of the best ways is getting into a good exercise routine, whatever that may entail for you, but also getting into some direct stretching. And we're going to run through 3 quick stretches here that give you something directly to kind of get started on, to kind of focus on relieving some of the tension in that area. One of them we call an anchor stretch, and basically this one, you can take a bath towel at home. That is one way to do this. You're going to hold one end of that, drop that towel down to the floor. You're going to hold the step on that other end, so that as you stand up nice and tall, basically that is anchoring that shoulder down to hold that end of the muscle. And then we're going to lean the head away. If you don't have a towel handy, you can just take the side you're stretching, place that hand behind your back. It'll help hold that in. And again, we're going to lean the head to the side. You can reach up. Those that are watching can join in. Try this. We're going to reach up with the other hand. Gently pull with this. Now you can kind of vary head position. If you pull a little more forward, you're going to get more of that back into that suboccipital base of the skull, down into the trap stretch going here, and really feel that stretching out. 20 to 30 seconds. Those of you with migraines, we probably want to get a little more of this big thick muscle in the front of the neck called the SCM muscle. Attaches right behind the ear down to the sternum. And from the side, instead of going forward, we're going to start with the side, and then we're going to kind of look up and back. And you're going to feel that really stretching out in here. So about 30 seconds, we're going to switch, do the other side, do each side twice with that one. That's called the anchor stretch. Second one is called a neck glide, or I would call a turtle exercise. Basically, we're creating motion in the joints, trying to free up some of the movement in the upper spine and inhibit some of the firing of what are called nociceptors, some of the pain fibers in there. So pain receptors, excuse me, in the upper part of the neck. So this one, we're going to look straight ahead. We're keeping the chin on a level. Another way to think of it is if we had a book on top of your head. We're not tilting. We don't want that book to fall off. It looks strange, but we're going to slide the chin forward, slide the chin back. So we're going front to back with this. Nice and easy, not through any pain, but front to back is 1. We want to do a couple sets of 10 with that. And then the last one we call a tea towel exercise. And basically the tea towel, we're going to take 2 bath towels, you're going to fold them in half, roll them up, so we actually make a T with it. That horizontal one part of the T we're going to lay underneath the neck. The vertical other towel we're going to place right between the shoulder blades. So as you lay back on these, you're actually going to feel, kind of like your chest is pushing up, head will be back a bit. Should not be any pain or discomfort with that at all, but we're just going to relax over those for about 10 minutes. You're going to feel a little support to the curve. We're stretching some of these anterior muscles, taking tension off those posterior muscles. And then periodically through that 10 minutes, we recommend bringing your arms out, letting them drop, really stretching the upper chest and shoulders. 15-20 seconds with that, bring the arms back in. Gonna do that 3-4 times during that 10-minute stretch. But those are 3 easy stretches you can get started on right away. If you have a headache, you can place some ice over that upper towel right under the base of the skull to kind of help knock down any inflammation there. Works really well. So action step 3, we need to get some regular routine exercise going. Again, whether that be walking, swimming, biking, lifting weights, getting some regular exercise along with some base stretches. And these 3 stretches are things you can implement, really right away. So, our 4th action step, and probably the most important action step out of these, and you're going to say, well, of course you're going to say this, you are a chiropractor. And while that's true, it still is the most important step. We need to see a chiropractor. If you deal with headaches, no matter the type, tension, migraine, or other, chiropractor is probably going to be your best friend. We talked, the majority of these types of headaches are cervicogenic in nature, again, meaning they come from that upper part of the neck. If all you have been doing is taking, ibuprofen, Advil, Imitrex, any of those heavier duty prescription meds, it's kind of like, the check engine light came on in your car and you took a piece of tape and just covered over it. You're just masking the symptom of it, and it will feel better temporarily, but you go enough time, eventually, in the check engine light example, the engine's going to blow. Well, eventually, your body, something bigger is going to happen. So we have to address why we're getting these headaches, what the cause is. If it is from more of that upper part of the neck, there is a ton that can be done to reduce the intensity, frequency, duration of those headaches that, can be a game changer and a life changer for you. So, we need to get in and see a chiropractor and have that actually evaluated, get a good exam done, get through some ranges of motion, orthopedic, neurologic tests, probably some x-rays in there, get a better look at what's actually happening, and then decide from that point, is it a chiropractic case, or, is it something in the rare cases that we need to refer, or is it something that we're ready for, then. So, from that side of things, recapping our 4 action steps. First one, we need to improve our digital ergonomics and our digital posture. We need to improve our sleep postures and our support. We need to reduce stress through exercise, stretching, massage. And step 4, we need to get in and see a chiropractor. We need to get some of that taken care of and actually evaluated once and for all. So again, guys, those of you on, seeing this, hit that wow button, hit that like button, tag a friend that needs to see this, type their name in the comments. Otherwise, certainly, if you're having a headache, if you're having an issue, give us a call here at the office. Our number's 402-484-5166. You can stop in and see us. We're at 1600 South 70th Street here in Lincoln and Lincolnshire Plaza. Our services are covered by almost all insurance, and certainly if you're someone that sees this video that's been suffering with headaches and have been wondering if chiropractic can help you, get in touch with us. You can go to our website too at comfortlincoln.com, request an appointment through that, or call us. We will do a free consultation to start with, be able to determine if we think it could be a good chiropractic problem or not, and we'd sure love to help you and get you better, along with the thousands that we've helped prior with this too. So reminder too, next week we're going to be doing this Facebook Live every week with a different topic, so we'll be back at it next Wednesday at 1, and we'll look forward to hopefully seeing more of you then. Have a great day.